In India, out-of-pocket healthcare expenses are key driver of poverty and more so for families who come from economically weaker sections as they run from pillar to post for diagnostics and treatment. Health justice can only be realized if vulnerable sections of the society get access to quality and affordable health care. While the public hospitals serve the needs of lakhs of patients across the state, yet the dimension of patient-centric care in public health is still evolving. After working with economically weaker sections in medical distress for over a decade, Helping Hand Foundation, one of the leading non-government public health organizations, has consciously embarked on a more sustainable model of linking the common man to public health system while continuing to support patients in medical exigencies.
The philosophy behind this has been that if you look at the scenario in India, that 70% of the people, as per a recent National Health Account survey, access Medicare in the private sector. Now, what this means is basically that a huge segment falls into poverty because of this out-of-pocket expenses which they incur, which is beyond their means to basically access private healthcare. Now, if we are to do justice, we need to link these people or encourage them to get into the public health system, and that is what we precisely are doing today.
Today, the patient care support which the foundation has brought in collaboration with state-run hospitals is built on the philosophy of empathy, compassion and trust, which is helping build and restore patient confidence in public health care. Today, Helping Hand Foundation has its services spread across 30 state-run hospitals across the city, with over 100 plus passionate healthcare providers relentlessly working in assisting hundreds and thousands of patients on a day-to-day basis in our public hospitals.
We are utilizing the services where we are not in a position to do from the government hospital, like counseling, transportation, rehabilitation of the patient, and sanitation of the patients. Personal care of the patients are done by Helping Hand Foundation.
For the first time in history, Helping Hand Foundation has also taken up the responsibility of many abandoned patients, where a team of Arogya Doots trained under MEPMP provide bedside care for patients without attendants. This is proving to be a boon to many patients who are mostly daily wagers and without attenders. Personalized services like face and body wash, hair, scalp and nail care, bed making, bed sore and wound dressing with a highly personal touch are bringing back smiles to hundreds of destitute in our hospitals.
These are small things, but at the end of the day, if you look at the overall spectrum, and the philosophy is that the patient experience is improving. They're getting more confidence and credibility in the system, and that is what we are aiming at.
Stepping into areas that are stigmatized over many years, Helping Hand Foundation has counseled and given hope to the survivors of HIV and TB and helped them regain their confidence and strength to lead lives like all others. Helping Hand Foundation runs today a 30-bedded and one-of-its-kind palliative care center for HIV/AIDS in collaboration with Shivananda Rehabilitation Home.
तबीयत ख़राब हो रही बोल के मैं उस्मानिया गया था। उस्मानिया में जाने के बाद पूरा रिपोर्ट्स निकाला, सब निकाला। उसके बाद में टीबी और HIV बोल के बोला मेरे को। बोलने के बाद में हमारा कोई सहारा नहीं था। प्रेजेंट में अब क्या कर रहे हैं बोले तो टेलर के पास से कपड़े ला के सी रहा हूँ घर पे। बोले तो मशीन है क्या, बोले नहीं है। बोले तो मेरे को मदद करे, मशीन भी लेके दी है, सिलाई मशीन।
Alongside, Helping Hand Foundation has also sheltered TB survivors who have been abandoned by their families and the society.
हम 8 दिन में जा जाते ना बोल के सोच के रागड्डे में जाके शरीक हो गए। उसके बाद में 8 दिन जाके वो 2 महीने हो गए तो मैं शौहर बोले नहीं नहीं अभी कब तक रखते कि आपको मेरे से रहना नहीं होता, बल्कि उन्होंने भी साथ छोड़ के चले गए के बाद में अभी 3 महीने रहे वैसी जम। बहुत रोते थे बच्चों के हंसते मेरे बच्चे, मैं अच्छी होती हूँ कि नहीं, कि रोज़ाना पाइप लगा के पानी निकालते थे। वो दर्द से बहुत रोते थे। तो हेल्पिंग हैंड फाउंडेशन वाले लेके आके जो है मेरे को प्राइवेट में बताए, ये रूम लिए, पहले ये रूम लेके रखे, उसके बाद में मेरे को लेके जाके प्राइवेट में शरीक कराए।
In another dimension, where life and hope begin anew, the Helping Hand Foundation volunteers offer skill-based assistance in maternal and child care. From pre-delivery education on nutrition, health and sanitation, handling newborn data sheets at the operation theatre, nursing babies at SNICU, kangaroo baby care for low-weight babies, assisting mothers in breastfeeding, to training mothers to wrap and carry their babies, they make motherhood a blessed experience for all.
Employees of their Helping Hand Foundation who are working with us in our hospital, and he gave me a free hand to utilize them wherever I want. So I have used them in the admission room for helping the patients come where they have to go, how they have to go. Then I have utilized them in the theatre, which is very, very important for me.
Because Helping Hand Foundation works with a mission, barriers of communication have not imputed the services they provide. Apart from skill-based knowledge, the volunteers have earned their trust among patients and have mastered communication with them.
My name is Habibunnisa. I'm 16 years old. I am deaf and mute since childhood. I come here to the ENT hospital for my regular checkups. I cannot hear since my childhood and it becomes difficult for me to talk to people. I thank the volunteers of HHF for helping me.
They are doing good job. They are definitely helping our people to guide the patients where to go, investigations and where to take the tablet, where to go for a checkup, doctor or other investigations, X-ray, CT scan. So that way they are very helpful.
Helping Hand Foundation firmly believes that there is lot of promise and hope in traditional medicine, namely Unani, and with this vision today, Helping Hand Foundation has joined hands with one of the oldest Unani hospital in the city, built by the erstwhile ruler of Hyderabad, and has been working in improving patient care and the facilities at the grand old hospital.
जो हेल्पिंग हैंड फाउंडेशन के जो वॉलंटियर्स है 5 या 6 कुछ आए हैं हमारे पास, तो ये लोग पेशेंट को जाके जो है बिल्कुल बेड टू बेड जो देख रहे हैं, उन लोगों को साफ सफाई का ख्याल रख रहे हैं.
Helping Hand Foundation has also achieved a major milestone in reaching out to people in their communities. The Helping Hand Foundation run Primary Health Center is one such innovation that bridges the gap between poverty and medical relief.
10-15 गोलियां खाती थी, 1 से 2 दवाखाने को गए, बहुत दवाखाने फिरे, फिर भी मेरी तबीयत ठीक नहीं रहती थी. यहाँ मस्जिद इशाक में क्लिनिक खुला और वहाँ डॉक्टर साहब दवाखाने को भेजे तो फिर वहाँ पर जो सो 1 से 2-3 गोलियों पे लेके आए.
The Helping Hand Foundation helpline is another game changer that people can access and receive assistance during medical emergencies. The ambulance service and free cab services complement the helpline. Every patient that comes into their radar is tracked and monitored through a back-end WhatsApp-enabled call center till he or she is completely treated, cured and sent back home.
कैंसर का ट्यूमर है बल्कि बोले नहीं, चलने भी लायक नहीं थे ना, और कोई चीज़ अब तकरीबन 1.5 साल हो गया इनका इलाज चलते कोई चीज़ नहीं पच रही थी इनको और चलने के भी काबिल नहीं थे. अब अल्लाह का फजल हो गया कि अच्छा इलाज हो रहा और हेल्पिंग फाउंडेशन की तरफ से डॉक्टर्स थे,
Thank you, foundation.
To enhance patient comfort, which is critical to their experience, Helping Hand Foundation has also been improving seating, lighting, flooring, painting in major public hospitals, apart from donating luggage and garbage trolleys, wheelchairs, and trolleys to improve patient mobility, hygiene, and sanitation.
This is the unique services rendering by this foundation, Helping Hand Foundation. They are staying and they are with the patients, with the staff, having the interaction with the higher officials and the needy people, and they are approaching us what to be done, what can be done.
Spanning across all government hospitals across the city, Helping Hand Foundation has left no stone unturned in facilitating people to access public healthcare services, hand-holding patients and providing special assistance fit for each hospital.
Helping Hand Foundation is working continuously with us. They usually guide the patients. So these people are very useful to the hospital. Patients who walk in doesn't know where to go and where are the particular numbers in the hospital, upstairs, downstairs, which room to go. So that aspect is taken care by Helping Hand. We are very thankful to them.
What makes Helping Hand Foundation different from all others is the fact that they work with passion and a vision to make life happier and healthier for people irrespective of their economic and social status.
What is important for us is to forge stronger partnership with the government. We are a small NGO. We've got our own limitations. We cannot change the face of things in the hospitals. So we need a very strong understanding partnership going forward with the government so that this model is scalable. Today we operate in Hyderabad. We want to offer the services across the state in different districts and different remote areas so that more and more people can take advantage of the system.